Here we're going to discuss the extrinsic muscles of the tongue in a lateral view, the intrinsic muscles of the tongue in an anterior view, and the muscles of the soft palate from a posterior view. First, we will discuss the extrinsic muscles, which consist of the genioglossus muscle, which helps protrude the tongue out. We have the hyoglossus muscle, which helps retract and pull down. We have the styloglossus muscle, which helps to elevate and retract. And we have the palatoglossus, which helps with elevation of the posterior part of the tongue. In an anterior view of the intrinsic muscles, we have the superior longitudinal, the transverse and vertical muscles, and we have the inferior longitudinal, which all together change the shape of the tongue. And just for perspective, we have the hyoglossus and the genioglossus muscles here to relate for positioning. Here we have the posterior view where we have the tensor veli palatini, which hooks around the hamulus of the medial pterygoid plate, and that helps to tense the palate. We have the levator veli palatini, which helps to elevate the palate. We have the muscular uvula, which helps to elevate the uvula. And we have the palatopharyngeus muscle, which helps to raise the pharynx superiorly, as well as tense the palate during swallowing. And we have the palatoglossus, which is not usually shown in the posterior view due to the superior pharyngeal constrictor muscle, but it helps to elevate the posterior part of the tongue and to lower the palate to help during swallowing. The extrinsic muscles, except for the palatoglossus, receives motor innervation from the hypoglossal nerve. The palatoglossus receives motor innervation off the vagus as it continues down. The tongue itself can be divided into anterior 2/3 and posterior 1/3, where the anterior 2/3 receives sensation that travels the lingual nerve up to the trigeminal and receives taste through the lingual to the chorda tympani to the facial nerve. The posterior 1/3 receives sensation and taste and travels through the glossopharyngeal nerve. For the soft palate, only the tensor veli palatini is innervated by a branch off the trigeminal nerve, and the rest of the muscles of the soft palate are innervated by the vagus nerve.